Foundations, Emotional and Behavioral Disorders. Some of the earliest recorded history of emotional disturbance describe behaviors consistent with schizophrenia as early as 1400 BC. In the 1500s, London's first asylum, St. Mary's of Bethlehem, eventually was referred to as Bedlam. Now, Bedlam refers to uproar or confusion. In the French asylums, patients who were mentally ill were routinely hosed down with cold water or beaten because it was thought that these disturbed people could not feel pain, and if made to feel the pain, they would be cured. In the 1700s and 1800s, advocates demanded more humane treatment of people with mental illness. Philip Pinel, a French physician, ordered the chains removed from patients. Dr. Pinel was the first to recommend that treatment and care of the mentally ill be closer to normal life. The father of psychiatry in the U.S., Dr. Benjamin Rush and Dorothea Dix, helped establish institutions for the mentally ill. It wasn't until the late 1800s that interest in the emotional and behavioral problems of children began to surface. In 1904, G. Stanley Hall, a psychologist, published a 2-volume book on adolescent psychology. It was difficult to study EBD in children because we could not agree on terminology and because we still confused mental illness with mental retardation. By the 1960s, state institutions were crowded, so anything that could reduce behavioral problems and reduce costs was tried. This included Dr. Walter Freeman, who went across the country performing partial lobotomies. In the 1960s and the 1970s, numerous advances for children with emotional or behavioral disorders developed. The main focus was on applied behavioral analysis, ABA, and structured environments in the school, along with communications between the home and the school. Research demonstrated that this structure and ABA brought about success for these students. One example was Hewitt's engineered classroom. Another was the teaching family model. It was started in Kansas and used in Boys Town in Nebraska. Which brings us back to IDEA 2004's and Nickleby's expectation that schools and teachers use validated practices. EBD is one of the most controversial fields in special education. IDEA refers to this category as serious emotional disturbance, and in its definition does not include behavioral disorders. Technically, the term serious emotional disturbance implies that only students with emotional problems should be included, not those with behavioral problems. Yet few states use the term serious emotional disturbance, and school districts do give special education services to students with behavioral problems. 3 conditions in IDEA definition of serious emotional disturbance. 1. Chronicity. 2. Severity. 3. Difficulty in school. Chronic. The problems have to occur over a long period of time and just simply do not go away. Severity, to a marked degree, it's noticeable. Again, it's there over a long period of time and the degree is greater than what you see in the typical child. And it has to impact their educational performance. IDEA 2004 Definition of Serious Emotional Disturbance. Part 1. A condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. An inability to learn which cannot be explained by intellectual, sensory, or health factors. An inability to build or maintain satisfactory interpersonal relationships with peers and teachers. Inappropriate types of behavior or feelings under normal circumstances. A general pervasive mood of unhappiness or depression. A tendency to develop physical symptoms or fears associated with personal or school problems. Part 2. Emotional disturbance includes schizophrenia. The term does not apply to children who are socially maladjusted unless it is determined that they have an emotional disturbance. Now, there are controversies over IDEA 2004's definition. Here they are, 4 of them. 1. Vague, internally inconsistent, incomplete, nebulous, often illogical, and self-contradictory. 2. Requirement that the disorder must adversely affect educational performance. 3. Omission of students with social maladjusted from the category of emotional disturbance. 4. Subjectivity involved in determining what is meant by a long period of time and to a marked degree. The Council for Children with Behavioral Disorders is a division of CEC, the Council for Exceptional Children. Compare this definition with IDEA 2004's definition. What differences do you see? Here we go, the CCBD definition of EBD. The term emotional or behavioral disorder means a disability that is characterized by emotional or behavioral responses in school programs so different from appropriate age, cultural, or ethnic norms that the responses adversely affect educational performance, including academic, social, vocational, and personal skills. More than a temporary expected response to stressful events in the environment, consistently exhibited in 2 different settings, at least one of which is school-related, and unresponsive to direct intervention applied in the general education, or the child's condition is such that the general education interventions would be insufficient. Number 2, the term includes such a disability that coexists with other disabilities. Number 3, the term includes schizophrenic disorder, affective disorder, anxiety disorder, or other sustained disorders of conduct or adjustment affecting a child if the disorder affects educational performance in accordance with paragraph 1. So you see there is quite a bit of controversy concerning the definition of EBD. One group that we can go to for advice is the American Psychiatric Association. We use their Diagnostic and Statistical Manual of Mental Health to define disorders that we can fit within EBD. Here are the types of disorders that are defined within the DSM-4 manual. Anxiety disorders, disruptive behavioral disorders, eating disorders, mood or affective disorders, tic disorders, personality disorders, and psychotic disorders. Let's look at the prevalence of EBD. It is important to recognize that there are many students with inappropriate behaviors, but they could never be identified as EBD. There are some students with significant deviant or violent behaviors that schools would never identify as EBD. So the controversy continues even when we look at prevalence. For students ages 6 to 21, remember that the circle represents 6 million students who have disabilities and receive special education services. Out of those 6 million students, approximately 8.1% are categorized as EBD. 8% of the students with disabilities equals less than 1% of the school-age population. Currently, less than 1% of the school-age population are identified as EBD and receive services. The U.S. Office of Education estimates we should be serving 2% of the school-age population. Some studies indicate we should be serving 6 to 10% of the total school population. Some experts recommend using the rule of 1/3 to describe the EBD prevalence. So you see, there's controversy with the prevalence. What is the rule of 1/3? Let's run through it. Approximately 1/3, or 33%, of the whole school population will experience behavioral problems that concern their teachers at some time during any given year. 1/3 of those children, or 10% of the school population, will require intervention or assistance. And 1/3 of that group have significant behavioral problems that warrant special education. This final group equals 3.5% of the whole school population. Remember what we said before? We're currently serving less than 1% of the school population. The Office of Education recommends 2%, and the rule of 1/3 is saying it should be almost 4%. The prevalence of EBD, we continue with the fact that EBD is the 4th largest disability category. There are more males than females. Boys are more likely to have externalizing behaviors, and girls are more likely to have internalizing behaviors. Older students are identified more than younger students. Poverty appears to double the risk of EBD, and African American males are overrepresented in this disability category. Causes of EBD. Some are unknown: biological, environmental, combination of environmental and genetics, biological disorders and diseases, pathological family relationship, undesirable experiences at school, negative cultural influences. I won't talk about all of these, but we must visit 2 of them: pathological family relationships and undesirable experiences at school. When it comes to pathological family relationships, generally speaking, dysfunctional families teach dysfunction. Yet we must not overgeneralize. I had a friend who came from a severely dysfunctional family. When I asked her how in the world she learned to be such a great parent, and she was, she said, "If you won't laugh, I'll tell you. I learned from TV shows like The Waltons and Andy Griffin and Opie. So don't overgeneralize when it comes to families. Next, we must touch upon undesirable experiences at school. These may actually make a problem worse, such as a principal paddling a student for something the student truly doesn't understand. Think those type of things don't happen anymore? What about the Florida teacher in 2008 that made a kindergartner stand in front of class while everyone told him what they didn't like about him, and then the teacher allowed the children to vote this one little boy out of class? Advances in brain imagery are revealing new information about causes of EBD. During the next 20 years, there will be more significant advances in this field addressing causes, prevention, and treatment. As an educator, you need to stay informed and, in particular, learn about effective teaching strategies, because these students need an education that is special. Thanks for listening.